Hi, my name's Jackie Eastwood. I am a patient here at Royal Cornwall Hospital Trust. So I was diagnosed with cancer of the breast in 2012 and I had a lumpectomy at the time, and then came back for radiotherapy, and I got introduced to going on a trial called Fast Forward. So I think I had 3 weeks or 15 days of radiotherapy, and then following that I was signed up onto the trial, and I came back yearly for a regular checkup with the team here. Unfortunately, subsequently I was re-diagnosed with cancer again of the breast, but it had I can't say that.
Metastasized.
It gone into my bones.
Yeah.
So it's still breast cancer, but it's gone into my bones, unfortunately. Only a couple of places in my body. And I, straight away, I sort of said, is there any chance I can be on a trial? Is there a trial? So I was asking them, the team here, if there was anything that I could go on to help the future, I suppose, help future patients. I was really taken up on that straight away by the team here. So I came in and had quite a few discussions about what it was going to involve. Because if I'd have just not had a trial, I wouldn't have been looked after so well. And I think that that is part of the reason why I took them up on the chance to go on this trial. So I get regular monthly appointments here at the hospital, and I come and see the same team every month, and I have various checks and tests on me. I regularly, 4 monthly, I have 3 ECGs all in one day, and I have tablets that I have to take every day. Some tablets I take 3 weeks out of 4, others I take every single day. And I'm really well looked after when I come in here and have time with the team. I think the initial motivation was that it wasn't really going to do much. It wasn't really too onerous on me to do it. I mean, to come in here once a year to have a checkup into the Sunrise Centre with the team here, it's not onerous, is it? It's not too hard. It's not difficult in any way. So I just came in and it was a chance just to get a review of how I was as a person and how my treatment had been.
Yeah.
So it wasn't difficult, and it's easy to come in here and sit down and chat to the team here and have a physical examination. What's the harm in that? There's no harm, is there? And I think that's easy. And then for that to be put together with all those other people that are having a similar on the trial, that's great data, isn't it? And that's how these things work.
My name is Maddalena Cifu, and I'm a research doctor in oncology. I did the maths, and it's 14 years since Jackie has been, I could say, in our team. So she's been diagnosed with early stage breast cancer back in 2012, and she joined a clinical trial called Fast Forward, where she had treatment with curative intent and annual follow-ups. Unfortunately, her breast cancer came back in 2021, and Jackie obviously was very keen to be a participant in another clinical trial called Persevera. And she's been on this trial over the last 5 years, doing well, having monthly appointments, blood tests, CT scans, a lot of other investigations, and she's well, and she's tolerating the treatment really well, and her CT scans are all stable.
I think my care has been outstanding, to be fair. I've built a really great relationship with my oncologist, and she has brought me through all of those trials that I've had, the 2 trials, and I'm still on that trial, and I've built a real great trust with the team here. Sometimes there are ups and downs when I have to wait ages for my tablets or things like that, but I know that that's going to happen. So, I know I come in here and it's a regularity of appointments. I know that I can trust what I'm going to get, what I'm going to discuss, and I think that they've been brilliant. And I'm here to help other people in the world. You know, this trial is international. There's just under 1,000 people on this trial. I've read about it, so I know about it, and I'm not afraid of what I'm going through. But I'm here to help people in the future, you know, that potentially have this same illness, that if they get a better drug than what's out there now, then all good. That's how I look at it. I think for me, like the one thing that's really important is that trust element with the team that you're with. The nurses, I've said today that the nurses come and go, but my oncologist is here and I know that I can trust her. And, you know, previous people that were here who are now not here, you know, I had the trust in those people when I started, and I felt that they were on my side. And that's really what I feel, that anybody on a trial, they don't need to be frightened of what's ahead. They just need to get into the routine of it. I remember one of the nurses at the beginning said, "You'll just get used to it, Jackie." And you do get used to it. There's a lot that goes on for you. You know, it's a monthly appointment. It's injections at your doctor's. It's, you know, scans. I have to have scans regularly. So I do have to come quite often. But you sort of just get used to it, like that original nurse told me. And I think that that's, you know, that's important for anybody out there who's thinking about, oh, would I go on a trial? Well, yeah, you've just got to commit to that regularity and that ongoing care that you're going to receive here.